Now I would like to introduce you to our next speaker, which is Bruce Playfair, providing an overview of the NRC facility review. Bruce Playfair is a senior research council officer with the National Research Council, specializing in heavy vehicles and scientific facilities. Currently, his primary role is of leader, defense and security system and automotive and surface transportation research center. Over his 14 years at NRC, he had very different positions, including senior project manager, facility manager, director of ground vehicles, and director of operations. For the last 3 years, he has been the co-lead of an NRC major review of its scientific facility across Canada. We'll explain a bit more what this project encompassed, and we're very curious to hear about their findings and solutions. Prior to arriving at NRC, Bruce has worked as a Royal Canadian Electrical and Mechanical Engineering Officer in the Canadian Armed Force and with a number of private companies, including General Dynamics, Land Systems Canada. Please welcome Bruce Playfair.
Thanks a lot, Laurence, for that introduction, and thanks for having me. I'll just set up my screen share here. Hopefully this works. Are you seeing that properly?
Yes.
Perfect, thank you. Okay, so I'm going to talk to you about this project that I was co-lead of. I'm trying to compress 4 years of work into about 25 minutes, so I will be talking fairly quickly, and I'll probably be breezing over some of the topics. So my apologies, and I do invite questions, and I do invite conversations later on in the day. NRC, for those of you who don't know, is the National Research Council. It's Canada's premier or governmental research and development organization. We're about 4,000 people, and we're literally from coast to coast, from Victoria all the way to St. John's. We have 14 research centers, and we have locations in most major Canadian centers. So what we were trying to do was take a look at our facilities. It turned out to be 126 facilities all across Canada. And when I'm talking facilities, we're talking about things like telescopes and aircraft and hydrodynamic tanks and photonic manufacturing centers and biomaterial manufacturing centers. So a huge variety and a very large size. But to start off with, let me give you some background as to why we did this project. We had an activity in about 2016 called NRC Dialogue, and this was an opportunity for our senior executives to sit with the employees and discuss a whole range of topics, things like promotion criteria and scientific excellence, and attracting high quality personnel and health and safety, and a huge amount of different topics. The idea was that we'd have these discussions and certain themes would come out, the pain points that the employees were seeing. One of those themes that came out were surrounding our facilities. There was a concern over the cost of carrying our current inventory of facilities, their age, and their need for renewal or replacement. It was just felt that there wasn't enough investment going into our facilities, and they were starting to show it. There was also concern over the continued ability of the facilities to attract high quality personnel and support world-class research. The best people want to come work with the best toys. So this project, it was actually one of 60 coming out of the dialogue exercise, but this one was certainly the largest, and it had 3 goals. It basically, first of all, was to create an inventory of facilities. And that sounds really strange. But the fact of the matter is, as I said, NRC is made up of 14 research centers. Each research center had a fairly good idea of what it had, what it owned, but there wasn't really a comprehensive list at the corporate level to figure out what we actually had overall. So the first one was to create an inventory. The second one was determine the strategic value of each facility. How worthwhile was that facility to NRC and what NRC was trying to do? And the last one was provide information and recommendations for renewal and investment planning. That was really the goal, is to put enough information together to make good strategic investment plans. Now, we started this project in the latter part of September, or the latter part of 2017, and it went, we just finished it a couple months ago at the end of March. And it was about a team of about 7 or 8 people who were involved in this, some full-time, some part-time. So it was a very large effort. The logic flow that we used as part of this project, because really we started with a clean slate. It was a blank whiteboard when we were given this. We had to come up with some way of looking at this and analyzing it and coming up with a methodology. So the first one was really to identify the facilities. We had to create an inventory list. So how do we identify what a facility is? Well, first of all, we had to define what a facility was. And that wasn't easy. We wanted to try and put together something that was very objective, something very black and white, and we couldn't. We were dealing with such different types of facilities. All we really could put together were guidelines. But what we really ended up focusing on is a capability. The facility has to be providing a capability to its research center. And what we like to think about was a carpentry shop. So we're not examining a sander, a table saw, the drill press, any of those types of things. We're looking at together as a group. So it was that kind of mentality that we went out there. Yes, we're going to probably be grouping equipment together to look at this entire thing called a facility that produced a capability. And because it wasn't a black and white definition, we sat down with the individual research centers and we said, look, did we get this right? And we had long discussions to come up with that correct inventory list for the different research centers. Once we had that inventory list, we then tried to figure out what's the value statement of the facility. Now, value statement for all these different types of facilities were very broad. And from the research centers, we kept getting back things like, well, this facility is important because it makes a lot of money. This facility is important because it's having a huge impact to science. This facility is important because it's supporting industry, or this facility is absolutely unique in Canada. If we didn't have it, Canada wouldn't have this capability. So there's a lot of different ones. So what we did was we created 11 criteria, very broad, trying to capture all these possible value statements. So the 11 criteria were done in such a way that we didn't have an expected score that we wanted on these criteria. There was no expected outcome, and we didn't expect every facility or any facility to score well on all of the criteria. Each of the criteria was scored from 1 to 5, with 5 being more favorable to the facility and 1 being less favorable to the facility. And through scoring these 11 criteria, we were able to define a value statement for the facility. The next thing we had to do was prioritize that value statement. How important was that value statement to NRC and what NRC was trying to do? And so what we ended up doing, and we'll talk about this a little bit later, is we went in and looked at those criteria and said, okay, getting a group of experts together, what do you think is more important or less important to NRC? And we applied those weightings to the scores that we gave the facility. At the end, we evaluated those scores, that prioritized value statement against our investment needs. And we did this in a very logical order because we tried to look at this in terms of timeline. A facility probably doesn't have a life less than 10 years. It's going to be greater than 10 years. And when you're talking about a telescope, when you're talking about an aircraft or climatic chamber, it could easily be in the 40 or 50 year time frame. So the facilities don't change that often. The value statements are going to evolve over time. So yes, when we first have this facility, it's state of the art. We're doing some groundbreaking research. And then over time, we're probably going to evolve into something that's maybe doing more routine testing for clients to show conformity to a standard or something along those lines. So that's going to evolve over time. So it's a bit shorter lifespan. When you get to prioritizing the value statements, well, what's important to NRC or to the Canadian government can change very quickly. If you have an election and a different government comes in, that could change. We could have events like the COVID pandemic where priorities changed, or we could get into different international conflicts or things along those lines where the priorities may change. So we didn't want to do this in a way that we invalidated the data. If we had gone, we could have easily gone, and there was push to do this. Well, let's go talk to senior management at NRC, find out what's important to NRC, and then evaluate the facilities through that lens. And the problem is, as soon as you change the priorities, it invalidates the data that you've collected, or some of the data. This way, that value statement is probably not going to change very quickly, but we can still use that data, change those prioritized value statements, and get new results out of the data. So let's go in a little more detail about what the different stages were. So the 11 criteria here, I'm not going to go into a huge amount of detail, except to say, as I said before, there was no right score for any of these. In fact, many of these had a two-edged sword factor to it. For instance, utilization. If you're fully utilized, well, if the new opportunities come along, you're going to have to stop doing something in order to do new things. So yes, full utilization is good, but it can have some drawbacks as well. So we divided the criteria, the 11 criteria, into three main groups. The now, what's happening as we're doing the review, what's the status of the facility. The future, which is 10 years into the future, and we chose 10 years because we needed consistency between the reviews. And the past, and we chose 5 years in the past, again, to have some consistency. To go through these really quickly, technical capability. Is the facility state of the art? Is it starting to fall behind? If it's starting to fall behind, is it still able to meet the requirements of the clients that we have, whether they be researchers or industrial clients or whatever? Uniqueness. Is the facility unique in Canada? Is it unique in the world? Is it more common, and pretty much anybody operating in that area would have to have a facility like this? Operational capability. So these are all the things that support the capability or perhaps limit its productivity or quality. The example I like to use is near our Montreal Road campus here in Ottawa. We have a neighborhood going up beside us. It's starting to limit what we can do in some of our labs, or at least the time that we can do things in the lab. So that's one of those aspects that we would look at. Looking at the past, outcomes and impacts. Citations, certainly one of the ones that we looked at, but are we doing groundbreaking work with this facility? Are we creating standards and driving the industry to new things? Or are we really serving individual clients? Utilization, how much of the practical capacity is being utilized in the facility? Users, what's the diversity of the user base? Is the facility really only there to support one or two clients, or has it had a much broader and much healthier user base? A couple of these come into the financial side of things because ultimately we're looking at investments. Revenues attributed to cost is one of those. That is really looking at on a year-to-year basis, are the revenues generated by the facility enough to cover its costs? And not saying that that's good or bad, because we are an R&D organization. We're not there to make money. But if you're talking about a facility that might need a $5 million investment and it costs $100,000 each year to operate it because the revenues do not cover the costs, well, that has to be factored into that decision to reinvest in that facility. We then go into the future and we talk about threat levels, pretty standard stuff there. Are there other facilities that are being built that are equal or superior to the facility? Is the industry changing? Is the industry going away from this type of work? We then get into future opportunities. What's the industry doing? Is the industry expanding? Is the industry going along in the same type of way? How is that going to affect the facility? Innovative management co-investment, that's another one of these financial ones. And this is really looking at, is there an opportunity to share costs with someone? Many of our facilities operate and are popular because they are a third-party independent lab, and really don't suit the idea of having co-investment in them. So this was trying to measure of that potential. I mean, some of our facilities do have co-investment right now. So the last one is my favorite, impact of unfunding. It's an unfortunate title. We started out with that early on, and we decided not to change the title. It's not about unfunding or changing the budget of the facility. This is really about turning off the lights, locking the door, and not using the facility anymore. So as a whole, what's going to happen to our researchers? What's going to happen to our clients? And it's my favorite because it really dragged in a lot of the other discussions that we had on some of the other criteria. My example that I like using is one of our facilities right at the beginning. The committee sat there and said, yes, this is absolutely unique in Canada. When we got down to the impact of unfunding, okay, well, if we closed the facility, we didn't have the facility, what would happen? Oh, we just go to Joe's. Well, hold on a second. You said it was unique in Canada. How can we just go to Joe's? And it turned out, it brought out a subtlety of the argument because the facility was unique because it was the largest in Canada. But most of our clients didn't need that size. So yes, they could go to someplace else, even though it was unique in Canada. And that's one of the other strengths of these criteria is that there is a certain overlap, and it draws out some of these subtleties in the story for the facility by going through these things. Yes, a facility that's used 100% of the time should be having good revenues. Maybe it isn't, and maybe there needs to be an explanation as to why that happens. So for each facility, we went through this assessment process. We went to the research center who owned the facility. We gave them a template and guideline and said, write us a self-assessment. And the self-assessment was a description of the facility. It was a score for each of the criteria and supporting arguments, as well as any investment information that we needed as well. So they went away, did that. It came back about 20 pages. We then brought in a bunch of external experts who operate in the field that the facility operates in. And they came in for two reasons. One, to give us a view, a broader view of the industry, one that's outside of NRC, what's happening out there, but the other to go in and challenge the self-assessment and the findings of the self-assessment. Now, we did this through a moderated discussion, and this committee would rescore those 11 criteria, provide any additional arguments, and basically just validate the information that was already there. So those two documents would get put together into an executive summary we call the dashboard, and then that information would go towards creating this renewal plan. So we have the value statements. Those 11 criteria and the scores show the value statement for the facility. But what we needed to do at this point was to rate those, to prioritize them against each other. And what we decided to do was for each of the criteria, we would give it a weighting related to how important that criteria was for NRC. We brought in a bunch of our senior managers, our directors general for all 14 of the research centers, and we put them through a couple of exercises. One of the first exercise was an individual exercise, and it was basically called a discrete choice experiment. So at the bottom of the screen here, you can see option 1 and option 2. And they were presented with a pair of options like this and said, okay, based on these scores, which do you think is more important for NRC? And they would select option 1 or option 2 based on their own thoughts. Then they'd be given another pair. And in fact, they were given 125 pairs in total to try and pull out and to analyze what their biases were for each of these criteria. And it was an adaptive program. I went through the pilot program for this, and it was quite interesting because I used 3 criteria that I thought were important. The program actually figured that out fairly quickly and started holding everything else the same and just changing those 3 to see exactly where my bias lie down to the individual criteria. The end result is we had 14 people go through this 125 times. It was a lot of data. Some criteria, the variance was very low. Some of it was higher, and we had a workshop where all of the audience got together and reviewed the work that they had done and came up with a finalized weighting based on more of an open discussion of what people thought about the various criteria and how relevant they were. The end result, the strategic merit score, was the score for the criteria times the weighting for the criteria added up for all 11 criteria to create an overall strategic merit score for each facility. So what did we do with this? So we created this graph. At the same time we were getting the self-assessment, we were asking them, what investment needs do you have? And we plotted the strategic merit score, which came in between about 26 and 84, 85. And we plotted that against the investment requirements for each of the facilities. And we came out with a graph like this. Now, remember, we have 32 pages of information on each of these facilities. So we can go really into a deep dive, come up with a good business case as to why this facility is important. But that wasn't what we wanted to try and do with the process. What we wanted to try and do was to group things to make those decisions easier, to make group decisions rather than individual decisions. So what we ended up doing was we divided this into 3 levels of investment, basically under $1 million over the next 10 years, $1 million to $10 million over the next 10 years, and 10 million and more over the next 10 years. We also created what we considered a minimum score for the strategic merit, and that's what you see there in the delineation line, and we'll get back to that in a second. So group 1, these were 11 facilities that when put together, they actually were about half of the investment requirement. So we looked at that and said that's beyond what NRC can do internally with its own budget. So those ones we're going to create individual business cases. We're going to submit them to Treasury Board or other funding agencies and ask for support for those facilities. So those would be looked at sort of on an individual basis. Group 2 was more of our focus. This group, we tried to create the right size so that NRC could deal with this through its own budget process. So this would be our investment plan for the next 10 years. And that's where the delineation line came in. We had a value that we thought NRC could handle, and we moved that delineation line up or down to make sure that group 2 was an appropriate size. If group 2 came out to 300 million, we didn't think that NRC could handle 300 million over the next 10 years, then we moved the delineation line to the right, we reduced the number of facilities in there, and came up with a more reasonable result. And the other was true. If it was too small, we felt we could do more, we moved the delineation line to the left. So that really caused where that delineation line was. The oranges, group 3, under $1 million over the next 10 years. We said to individual research centers, you have the budget internally to do that yourself. You do it on your own time and in your own priority. The last group, group 4, we said, well, these are the ones that fell under that minimum strategic merit score. But we did realize that some of the methodology could handicap certain facilities. Newer facilities that didn't have 5 years of history would be handicapped somewhat. So we didn't want to say, hey, group 4, just get rid of them. We said, group 4, go in there and justify why we need to carry on having that facility and why we should still support it. Some people would come back and say, well, you know, we need practically no investment whatsoever, but there's still a cost to carrying it, to advertising it, to have someone who is an expert in it to support the facility. So it wasn't that simple. So the results overview for this project was we looked at almost $2 billion worth of facilities or infrastructure all across Canada. The 10-year investment need came out to 734 million, which was actually almost exactly 40%, which seemed to pass the stink test to say, yeah, 40% over the next 10 years. Yeah, that's a reasonable renewal of your facilities. And we created a wealth of information about NRC's facilities, their place within the broader national, international landscape, etc., that's going to drive our investments over the next number of years. We also suggested that this become a renewable review. Our research facilities by law have to be reviewed every 5 years. And we said, hey, at the same time, you should go in, look at their facilities and see if that value statement has changed for the facility. And also take a look and say, has our policies changed? Do we really need to redo the prioritization of those different criteria? The other thing it created, which we found very interesting, and there's going to be a lot of analysis on that, is when it comes to the overall scores. NRC likes to think of itself as a world-class research organization with very unique facilities, and going across and looking at the scores for uniqueness for all 126 facilities tells a certain story. What's the impact that we're doing with these facilities? Where do we actually come in? And where are there improvements that we think we need to do? So overall, it was a very, very interesting exercise. It's leading into work we're doing with Laboratories Canada, which is a Canadian government initiative, and a variety of things. And we've gotten very, very positive feedback over our methodology and our overall results. And that's all I have. And if there are any questions, I'd be happy to field them. I'll stop sharing this.
Thanks a lot, Bruce. So we definitely have quite a few questions. For the sake of time, I'm going to just ask one. But of course, Bruce, you can type your answer publicly on the Q&A so that everybody can see your answer, and we'll definitely make sure we continue conversation offline, and anybody wants to be in touch with Bruce, I'm sure he'll be more than happy to.
And I invite people to reach out and talk to me. This was the last 4 years of my life, so yeah, I've got a lot to say about it.
Yeah, I'm sure. Okay, so I'm going to ask the first question that came up with the most votes. And this is something I forgot to remind everyone. You can put a thumbs up if some of the questions are interesting for you too. So it's from Jeff. I'm curious who provided the information to address the NRC's assessment criteria and how they were supported in this process. Were NRC staff from your team involved to ensure consistent reporting across all of the facilities? My concern is that individual variation in France with reporting might confront actual differences between facilities.
Yeah, no, consistency was a huge issue for us, especially because we were dealing with such different areas of science. How we handled that was fairly basic. We had put a project team together. The project team was extremely knowledgeable. I mean, we came up with these criteria. We came up with word pictures for each of the scores. And we went through and reviewed all the reports that were coming in to make sure that there was consistency, that when we talked about unique in Canada for one facility, it meant the same thing for unique in Canada for another facility. So we tried to come up with some metrics and some really objective ways. The best way of doing it really was just having knowledgeable staff and who maintain that consistency themselves.